Also in the past couple of years. Oh, sorry, there we go. Supporting 16 new teaching health center graduate medical education programs. So again, this is putting these training programs in community health centers, primary care and dental, and it gives an opportunity to do outpatient primary care and dental in these community-based settings. We do know that when people are able to do their clinical rotations at a minimum, but ideally do their residency in health centers, they often catch the bug to continue practicing in a health center, and we are very proud of that, and we continue to grow that program. Another big push from HRSA in the last probably decade or so is the integration of behavioral health services into primary care. Most of our health centers have a very strong behavioral health component, and most of those do include substance use disorder services as well. We have also increased the number of states and regions that have pediatric mental health care teams by nearly 40%. And these teams do provide direct behavioral health, like teleconsultation to pediatricians and other primary care providers for children through the Pediatric Mental Health Care Access Program. We have also supported over 7,000 substance use disorder providers who are working to combat the opioid crisis, and more than 2,500 of those are providing that care in rural communities. And we have also helped to establish and expand medication-assisted treatment at over 230 sites, particularly within rural communities. So again, I work in the Office of Intergovernmental and External Affairs, and you're probably like, what is that? Well, I'll tell you what I'm not. I don't hold the purse strings for any part of HRSA. I'm not a project officer. I'm not a grant officer. I am the no wrong door part of HRSA. If you don't know where to go, you come to me or my team, and we will help you. Sometimes it's just a matter of I've been sending emails and they're going into a black hole. You have a question about a HRSA program and you're not sure where to start, call me. We are the agency lead on anything intergovernmental, external affairs, tribal affairs, regional operations. Again, I'm based in Region 9, which is San Francisco, but I'm all over the place. So if you need something, please don't hesitate to reach out to me. I will have my contact information at the end of my slideshow, but if I don't have the answers, I promise I will work hard to find them for you or get you in touch with who does. And again, there is no wrong door. We work with current HRSA grantees, potential HRSA grantees, which could be you all, state and local leadership. There I am with Senator Hirano. That was a surprise, again, when I was on Maui back in March. Community faith-based organizations. We do a lot of work with colleges and universities, a lot of work with the University of Hawaii, other agencies, you name it, we can probably find a reason to collaborate with them. So again, when you think of me, think of no wrong door. I don't know where to go, call Val and I'll help you out. So with that being said, I don't know how many of you, again, I don't want to look at my chat box right now because I'm going to take down my screens if I do. But if you do have a HRSA grant, would you mind just doing like a clap or a thumbs up so I can see that come up? Right now, for those of you who are familiar with how the federal funding process goes, we are at the tail end of fiscal year 2024. The fiscal year ends September 30th and starts October 1st. For those of you who follow federal grant funding or federal funding in general, you know that our funding depends on what Congress gives us. This year, because of a lot of continuing resolutions, we didn't really get our funding until April. So for those of you who have applied for funding either from HRSA or other federal agencies, you may have seen that you've had very quick turnaround times to turn those grants in. From HRSA's standpoint, we usually try to give 60 to 90 days. Some of those grant NOFOs, the notice of funding opportunities, did not go out until June or July, which meant that realistically, we could not give anybody 60 or 90 days. Those grants had to be turned in, they need to be reviewed, and then the money needs to be out the door by September 30th. So what I'm about to share with you is what HRSA has asked for fiscal year 25, which again, In theory, starts October 1st, but it will be up to Congress to decide what of our asks they will fund and when that funding will happen. So again, please take this as a snapshot in time, and know that this is what we anticipate or what we've asked for. And we won't know what actually gets approved until Congress gives a budget. So with that caveat, let's take a look. So I mentioned we do a lot of health workforce training. HRSA has really been a lead on that. I would say I've been with HRSA now 15 years, basically since I walked in the door. National Health Service Corps was the big push. During the Obama administration, there was a huge increase in funding for that. That hasn't changed, but as I mentioned before, we recognize that that is just one part of a larger component, right? Like getting scholarships for those who are currently in med school or plan to go to med school, or loan repayment for those who come out and are working in a high HPSA score facility are eligible. But there's so much more that goes into a healthcare workforce. So right now, we have been pushing out various advanced nursing education programs. For example, in the past, we've done a maternity care nursing workforce expansion program. That's just an example of what potentially can come out if we get advanced nursing education program funding. And basically what this program does, and it might again be narrowed down to specificity of what kind of nurses we're looking for, but essentially we want primary care nurse practitioners, we want clinical nurse specialists, and nurse midwives. We want those nurses who can be out in the community providing primary care services, mental health, substance use disorder care, and certainly maternal health care. We know that there is a maternal health care crisis in this country. Improving maternal health outcomes is a huge priority for HRSA. So I wouldn't be surprised if we don't focus on that again, but again, without knowing exactly what funding we will have, this is just, this is where we're at. But if we get this funding, those who apply, and again, it's usually a college, university, it supports the training and the graduation of these APRNs into the disciplines. We also support nursing workforce diversity programs, and these programs aim to increase the nursing education opportunities from individuals who are from disadvantaged backgrounds. And that again includes racial and ethnic minorities. Each one of these has, a 2-page long description of what they are. I'm just trying to give you the 30,000-foot view highlight. And at the end of my presentation, I will tell you where you can find out more information. But again, these are anticipated asks along the nursing workforce. We also have done what we call the NEPQR program, the Nurse Education Practice Quality and Retention. And that is to get those nurses who had academic training to becoming an LPN or an LVN, who have that, getting them into an RN bridge program, and also becoming nurse clinical faculty. Because again, we know, at least in Region 9, and I'm pretty sure this is across the country, that there are plenty of students who would like to become nurses. There aren't enough faculty to teach them. And so it doesn't matter how many people want to get in nursing school if we don't have the folks to teach them. So part of this program, it's kind of a 2-parter where we try to get the non-RN nurses to become RNs, and then also try to help those nurses who would like to become faculty, give them the training to become faculty and work at universities and colleges to become part of the nurse education programs. We also have the nurse faculty loan program. So again, if you are a nurse and you decide you want to teach, this program helps you by giving you a low interest loan to become or stay being nurse faculty while you're studying for that. So we'll say the University of Hawaii becomes a program that gets that NEPQR program. Okay, you decide you want to go and become a nurse faculty. Well, the loan program would help you while you're studying, and the loan cancellation could help you if you stay on to become faculty. So again, really looking at low interest loans, scholarships, and loan repayments for those who continue to give back to the nursing healthcare workforce. I previously mentioned the Nurse Corps Again, that's part of the overall National Health Service Corps. These are scholarships for loan repayments. Again, you have to work in what's called a high HPSA score. HPSA, for those of you who don't know, it's a health professional shortage area. The higher the score, the more likely a facility is to be able to get their pick of National Health Service Corps and Nurse Service Corps scholarship and loan repayment providers. The HCOP program, the Health Careers Opportunity Program, and that program looks to improve recruitment, matriculation, graduation, retention rates by implementing enrichment programs to address the academic and social needs of students from disadvantaged backgrounds, and providing actual hands-on community-based health professions training, really trying to emphasize experience in underserved communities. Again, if you're all healthcare providers, I see a few of you on there that are, you know that being able to do a clinical rotation or your residency in some of these underserved communities, whether it's at a health center in a city or a rural health area, allows you to experience something you might not have been able to do. And we know that when folks have that opportunity, they tend to stay, if not at the site they were trained at a similar site. Along those lines, we also have the Scholarships for Disadvantaged Students program, the Geriatric Workforce Enhancement Program, which is another one. I don't think I need to tell any of my friends in Hawaii that our communities are getting older and we have less people who are trained to provide healthcare services. So this program educates and trains the healthcare and the supportive care workforce to care for older adults. It collaborates with community partners depending on who gets the grant. Some of the GWEP programs actually train family members on how to care for the older adults so that they can stay at home, which I know particularly in Hawaii, for families, that's really important to keep your elders in a home with you as long as you can. So GWEP program can help with that. And then we also have the Geriatrics Academic Career Awards, which again, it supports the career development of junior faculty who want to become specialists in geriatrics care. The Primary Care Training and Enhancement Program, again, if you can't catch a theme here, we're really focusing on primary care. We want to get the next generation of primary care clinicians, those who want to teach the next round of primary care clinicians, and those who want to do research in rural and underserved areas. The 2023 PCTE grants supported the integration of mental health training into the training of primary care clinicians. Again, in rural areas in particular, we know sometimes it's very difficult to get behavioral health providers, and sometimes primary care providers have to do it all. So providing these training programs so that primary care providers can get that additional training and feel confident is really important to HRSA. Also looking at the mental health needs of children and adolescents. I don't need to tell my friends on Maui how devastating the fires were to the children of Maui, to the parents. That's why we were so excited that there is a school-based health center at Kihei Elementary School. We know that many children don't understand what's going on, and some of their behavioral health issues manifest in different ways, and it's often the schools that see it. So having primary care providers who understand this and know how to treat it and triage it if needed is really important. So again, we're hoping Congress will give us additional funding for that. The Opioid Impacted Family Support Program. This is really to expand paraprofessional knowledge. Again, this doesn't necessarily need to be a four-year degree. For those who work with folks who are in the recovery community, you know how important and invaluable peer support specialists are, and trying to get integrated interprofessional teams from across the gamut of training to understand how to work with those impacted by not just opioid use disorder, but substance use disorder writ large, and how to work with family members who are, sometimes in guardianship roles. We know often that grandparents or aunts or uncles end up taking in their grandchildren or their nieces and nephews when the parents have been impacted by substance use disorder. So we're hoping that program continues to receive funding. Again, most of our health centers do, to some extent, address substance use disorder. We, again, recognize that depending on the community you're in, trying to find a specialist may be difficult. And so we really work on trying to train the number of practitioners, including nurse practitioners, PAs, psychologists, nurses, social workers, to really provide these substance use disorder services in underserved community-based settings. Again, if you are at a HRSA funded health center, we work to integrate primary care, mental health, including substance use disorder services into one setting, a patient-centered medical home, so that there is no wrong door. As we know, if somebody is dealing with a substance use disorder issue, when they're ready for treatment, we need to be able to provide it for them. And so we have found by offering those under one roof that we have more success. Our health centers have more success, the patients have more success. So again, hoping that this funding shows up for us in fiscal year 25. Again, I mentioned the Teaching Health Center. This has been a huge program for HRSA. It allows the training of residents and dentists in primary care programs to do this in an ambulatory outpatient care settings. Again, it's primarily in rural or underserved communities, but we have found that we have more medical students that would love to do residencies here at a health center than we have health centers that have this program. So that's been a big push to increase this funding. The last few years, I don't know, probably 5-6 fiscal years, HRSA has had planning and development grants for these programs, which is basically like a 3-year startup funds, I guess, for lack of a better word, where a site can get that funding, get the program up and running. We know you can't just snap your fingers and have a residency program, with the goal that by the time those startup funds run out, you are ready to apply for the actual program and get that funding and open your door to residents. And the health centers that have these programs, as I said, have no shortage of residents who are clamoring to become part of it. A part of that is also, we've been a big push on rural residency program. Again, these are kind of like the startup funds, their planning and development program. It's usually 2 to 3 years of funding to get these up and running in rural areas. Again, we find that when people have the opportunity to practice in rural areas, and we have a lot of folks who would like to do that, but there's not enough residency to do it, they tend to stay. So we have some hospitals and health centers that are really trying to increase these rural residencies and have had great success in training and keeping the residents that they train. So fingers crossed that continues to get funded. The Rural Community Opioids Response Program, or what we call RCORP. We have a couple grantees in Hawaii who've received this, particularly on the Big Island. It just started out as a planning program, and now the RCORP has extended. The cool thing about the RCORP programs is that it's community-based. So you might have a health component that could be a hospital and or a health center, but also your first responders, a fire department. Maybe the library becomes part of this community opioid response program because they see people who are overdosing in the library and they get in the naloxone training. So it really is a cool program because it works for the needs of that community. And so for fiscal year 25, what we've asked for is stimulant support. We recognize that those folks who are using methadone in particular, there's no easy way. It's not like opioids where we have the different medications that can help with that. And what we've also heard, particularly from our grantees and partners in Region 9, is that meth continues to be a primary driver of substance use disorder out here. So again, the stimulant support program would work in rural communities to help address prevention, treatment, recovery services for individuals who are misusing psychostimulants. And then the RCORP overdose response program would, again, I was talking about the EMTs and the different places and communities where people might encounter somebody who is suffering an overdose. How do we train these folks? How do we get them access to naloxone? And that's what this program would do. We also, again, if you're sensing a theme here, rural health, very important. The Rural Health Care Services Outreach Program, community-based grant program, trying to promote rural healthcare services by connecting the various programs together. The idea is a consortium of health and social service programs, and giving them the opportunity to develop an innovative approach to the challenges they have in their specific communities. Again, I appreciate that HRSA has gone this route and giving communities a little more flexibility and addressing how they feel the best ways to address the needs in their community are. And one additional program is the Rural Health Network Development Planning Program. And again, this would be planning and development of integrated health networks. We're trying to achieve efficiency, expand access, and actually improve the quality of some basic healthcare services, which hopefully would then increase the health outcomes, improve health outcomes, and overall, hopefully strengthen the rural healthcare system. We do understand that rural health, depending on where you are, you may not have a hospital. A lot of critical access hospitals have closed over the past few years. And again, where we can, we try to work to connect the pieces that are there and support them to increase and where possible, expand the rural health networks. And then that is what we have on the horizon. I'm gonna try to get back on my camera and not crash my computer. And I know I threw a lot at you all. So before I go any further and tell you where to find this funding moving forward, does anybody have any questions? And if you do, please just get off mute. That would be fine with me. All right, pretty straightforward. So for those of you who have never written a grant before, there's two different ways to find federal grants writ large. Most can be found on grants.gov. You can search on that website. You can filter it for HRSA. One cool thing I like about grants.gov is you can look for what is currently open and what is forecasted. And if you're looking for, like I explained a bunch of grants to you that we're hoping that will get funded, once it appears on grants.gov and it'll say forecasted, sometimes we'll even have it narrowed down that we're hoping to, open it up in December or whatever. You can actually click and give your email address and get notification when it actually does open, so you're ready to go. You also could just go straight to HRSA's website, hrsa.gov/grants. But again, I suggest doing the email notifications when a grant that you might be interested in becomes available. If it is a grant we have funded in the past, which you can, either if you're familiar with it or you're not sure, did you fund that in the past? A quick Google search will tell you. And if we have funded it, I say use this time if you're really interested to see who got the funding. You can see, what they're doing. Reach out. Certainly, I know from our HRSA grantees, they are always happy to share their best practices or lessons learned. No need to reinvent the wheel, is my opinion. If there's a community similar, in size and demographics as yours, and somebody has a grant that looks to be open this year, reach out, ask them, tell them what you're looking for. I've never had an experience where a HRSA grantee will not help you. And furthermore, we're big onto the QR codes too, but you'll be getting a copy of this presentation. You can search using the QR code and you can get directly to our funding. Right now, I don't think there's anything listed because again, we're at the end of the fiscal year, but they may have listed what they anticipate coming out once our funding is appropriated by Congress. I'd also like to draw your attention to this. Again, I know I went over a lot, and if you did not participate in any of the previous webinars that our friends at the United Way have convened with my colleagues from other federal agencies, they did go over, as my understanding is, how like the basics of how to write a grant or how to apply for a grant on grants.gov. We here at HRSA have done a couple of webinars that have been recorded, a 3-part series, a 2-part series. The third one being a little bit more info on, like, if you have a grant, how to do a good job managing it. But if you have any questions, or you've written a grant and you didn't get it and you're not sure, like, what could I do differently? Please check out these recordings. Again, our Office of Federal Assistance and Acquisition Management, OFAM, does a really good job. They have some YouTube videos on, really in-depth aspects of grant writing, grant review, what to look for, how to manage your grant when you get it. That is definitely not my expertise when it goes into the weeds like that, but they do an excellent job. So please check out their webpage. And again, you can never go wrong going to our website. If you're looking for data, or you're looking to see, like, geez, who else got grants in Hawaii that, I can hit up and see what they're doing. If you go to our data warehouse at data.hrsa.gov, we have all sorts of interesting information there. We've got information about, again, who is currently receiving our grants, what they're doing. So check that out. And I'm going to stop sharing my screen. I know I went over a lot in a short period of time. Does anybody have any questions? I know I went through a lot very quickly.
I have a question. Thank you.
Other Valerie.
Another Valerie. Yes. And thank you for sharing all of this. So as I was listening to all these options and we explore opportunities, I kept hearing, hopefully they will fund it.
Yes.
Hopefully they will fund it.
Yep.
So how do we weave through all of that to find out where is it going to be funded, or is it just
it's a lot. So is it going to be funded as welcome to federal government? Is it going to be funded as a fun game we play every fall? Again, if you see on the news that, usually it's the first thing that comes up, like federal government potential shutdown or budget.
Right.
If you go to grants.gov and periodically check, again, I haven't looked this week to see what's in the hopper on the forecasted. Once stuff is on forecasted, again, we say when we anticipate being able to release that funding, put your email address in there. And when it opens up, like that, you can actually apply for it, you'll get an email. That's the best way to do it, because it's a lot to try to track it. Because even if we get funded, it takes a little bit of time from the time Congress agrees on a budget till it makes its way down. This year, as I said, we didn't really see our full HRSA funding until April. So, that takes a lot of time then to now try to get a year's worth of notice of funding opportunities out the door, have people, apply for them. HRSA does a very good job of usually having webinars for each NOFO that comes out so that you can ask questions. Almost all of those webinars where you can do the FAQs and they go over it are recorded. So again, I know my friends in Hawaii are on a 6-hour time difference usually from the folks in DC. So they usually record it and you can go back and listen. And usually from that, then they'll also develop an FAQ. So you can assume if you had a question, somebody else is thinking the same thing. So yeah, I suggest going to grants.gov when it says forecasted, you click on it, and then there's an opportunity to have you directly emailed when it opens up.
Thank you.
Your other option too is, and then I don't know this, if I'll get a copy of who joined, but I can also add you directly. HRSA Region 9, we have a e-blast that we do once or twice a month. I promise you it's not spam. We try to highlight the programs we funded and highlight the programs that are opening, our NOFOs that are opening. If you're interested, hopefully I get those email addresses and I can add you to our list, and you'll get, periodic emails from us, and you can see then. We try to send it out once or twice a month.
Thank you. That'd be very helpful.
You're welcome. There we go. Perfect. Anybody else have any questions? And I should say that when you go to grants.gov, I gave you a very high overview with like a 1 to 2 line about each program. Each NOFO will tell you who is eligible to apply. You would be shocked the number of people who apply for something, they spend all this time writing it, and then they go to submit it and they're like, oh, I'm not one of the eligible applicants. So really take your time and review, am I eligible? Can I do this? Our webinars that I showed you the links to, we try to go over some top 10 frequently asked questions and commonly made mistakes. You'd be surprised the number of people who go over the page limit, which automatically knocks you out. So pay attention to the most common sense things. If the question is, what location do you plan to serve? Don't say everywhere. Tell me, I plan to serve the community of Lahaina, specifically the 25-mile radius of blah, blah, blah. Like, answer the questions. And certainly if anybody has, really specific questions they have about, grants that they've applied for and didn't receive, you can reach out to me and I'll do my best to provide a little bit of, non-specific technical assistance to point you in the right direction, how to do it better moving forward.
Hello, Valerie. I'm Ku'ule with Native Hawaiian Philanthropy. So this is not a technical question. We have a wonderful grant writer on staff, and I feel like the technical side, we're golden. This is more so, hearing you go through all of the opportunities. The educational program that we're doing with mental health professionals on Maui, specifically for the wildfire survivors. I'm not seeing like a precise, ooh, we belong there. And I just wondered if there's someone I can email a very concise, this is what we're doing. Do you know if we even qualify and what category you would like us in? Or I just kind of had a question around knowing we're eligible in that
way. Send to me. I can't promise you I can point in the right. I mean, again, once we know what the funding is approved, it'll be a little bit easier.
Okay.
By and large, obviously our programs are for healthcare professionals, but if that is kind of the direction you're going, where you're trying to train healthcare professionals, it might fall under HRSA. If it's more of like a social service type thing, it may not. Again, ours tends to be pretty like, we're funding the University of Hawaii to do blah. However, with that being said, there have been some funded programs in the past. A couple of years ago, we did a community health worker training program where several community-based organizations actually got the funding to be the organization that did the training. So you're welcome to email me. I may not have an answer for you right now, because again, I don't know what exact funding is going to happen, but happy to, take it and see what I can point you into.
Amazing. Thank you so much for that. I have your email now. And then Lindsay, I believe Lindsay Shiroma was next. Thank you.
Hi, Valerie. I just wanted to, so in our previous trainings, we had our federal agencies also touch base a little bit about getting copies of previously approved grants, so people can look at that for like reference. I was wondering if maybe you can touch on that a little bit for people in this one in case they haven't quite seen the other ones.
So, and I shared with you the data warehouse link. They have renovated, I guess. The data warehouse would be the best word that's coming to mind recently. Somewhere in there, and I'll have to do a little bit of a deeper dive, there is a place where you can get, probably not the full grant, but you can get like the abstract that was submitted and funded. I don't think HRSA gives out the full grant, like application. We did that was years ago, and I have not seen that, but I definitely know that somewhere in our data warehouse, and I can try to do a deeper dive in that and send it to United Way to send out to you guys where you can find the abstracts that were funded. Because even that kind of puts you in the right direction, and you can understand what the organization's goal was for this funding. I hope that helps.
Awesome. Thank you so much. Any other questions for Valerie today?
I am gonna give you back an hour and 15 minutes of your time. If there's anything I've learned is that adults do not like to have their time wasted. And I want to give you an opportunity to kind of muck around on the websites that I gave you. Again, please feel free to reach out to me anytime. There is no wrong door. If I am not the right person, I will do my best to put you in contact with who is. And I will add Lisa, I don't want to mispronounce your name, to our mailing list. And if anybody else would like to be connected, I'm happy to add you to that. And fingers crossed that we get a federal budget very early on in the fiscal year. And then you all can go forth and apply for all of the federal grants that you are potentially eligible for. So yes, absolutely. A resilient and sustainable community.
I included a link to our survey. If you could please fill that out, that really helps us determine, how you feel about these, what kind of potential content you want in the future, so we can make this an ongoing thing for everybody. So it's really important if you could please fill that out, and I will include that survey as well in the email. So we'll follow up with an email to everyone once the recording for this is ready and put online, so that way you can refer back to it whenever you need to. And we'll make sure to include Valerie's information in there in case you need to ping her. Otherwise, unless there's any other questions, we hope you all have a great rest of your day, but we'll hang out here until everybody leaves, unless you need anything.
Questions. Otherwise, have a wonderful afternoon. Bye, guys.
Hi, Valerie. I have a question. My name is Corey Lejano. I'm so sorry. I'm actually representing Nahona Health in this meeting. But I had a few conversations with some partners, and there's been a lot of interest in working towards becoming a HRSA grantee.
Okay.
My question is, so if we were to go that route and, eventually apply to become a HRSA grantee or / entity, what's the I guess the timeline so if we're already seeing patients and we're providing primary care services, and I think it's like I think the minimum is at least a year. What would qualify us, or what time frame are we allowed to actually place an application?
Are you trying to become a HRSA funded health center?
Like I mean, we were looking at, not FQHC, so maybe a lookalike.
Okay.
But like what would be the timeline that I could expect? I'm sure it's years, but we've identified specific population demographic, and already conducted our needs assessments, but what kind of timeline would I expect?
Well, you'd have to, first of all, we'd have to have a new access point funding opportunity, which we currently have one open, but obviously it doesn't sound like you're not quite ready yet. So you have to have a new access point opportunity. And again, those don't open every year. So it's kind of keeping an eye out, like, is there a NAP funding opportunity? And then you apply. If your ducks are in a row, you can apply.
And how often do the NAPs pop up? Are they just as funding is available?
It's kind of as funding is available, to be honest with you.
Okay.
We've had the health center program has grown tremendously in my time at HRSA. Again, I've seen them every couple of years. It's not usually yearly, but again, that depends on Congress, to be honest with you.
Right. Okay, so I think the best thing for us is just to continue to prepare and be ready, I guess.
Yeah, absolutely.
Okay.
some folks who want to become a lookalike do work. There are plenty of consultants that will help you on that front. But again, if your ducks are in the row and you meet the requirements to become a new Access Point lookalike, you should apply.
Okay. For us, I think our limiting factor is also we're currently operating within the 5-mile radius of Malama currently. So once we, establish a brick and mortar outside of the 5-mile radius, I mean, we could get the letter of support for sure. We work very closely with Malama already, but I think for us that would be key, is to start seeing our patients out, within our designated target area, and then from there, I think we would definitely be able to consider putting the application in.
Yeah, I mean, I guess one thing that you do need, again, we have health centers that are near each other all over the place, right? And in San Francisco, there's plenty of health centers. It's a small city, right? But
Right.
you have to show what is it that you're going to provide that the current health center can't.
Yes.
Or is there a different population you're serving that the health centers?
Yes, correct.
So, again, and that's part of what you would clearly describe in your grant application.
Right. Okay. Thank you so much. I
You're
appreciate
very welcome. Yeah, no problem. Good luck with everything.
that. Thank you.
Anybody else have any other questions? All right, then, folks, I hope you have a wonderful afternoon. Take care and reach out if you have anything.